Hi, I'm Dr. Jane Levesque, and this is the Natural Fertility with Dr. Jane podcast, where we uncover the real reasons behind your fertility struggles. In this podcast episode, I'm going to go through PMOS, the real root causes that are supported by research. I'm going to go through how it really works and all of the systems that are involved. We're going to go through the testing and different assessments that we as natural fertility experts use in order to help our patients understand what's going on in our bodies and the treatment that we're using, lifestyle, and different approaches to actually help to reverse this disease. So our patients can have not only a better quality of life, but they can conceive naturally, they can have healthy pregnancies and healthy babies. So first of all, the really exciting thing is we have renamed this disease. It is now called polyendocrine metabolic syndrome, which is much more representative of what is going on in the body. As natural fertility experts, we have known, and other functional practitioners in the space, we have known this disease is not about the ovaries for a long time. We know that there is a big metabolic component. We know that there is a big component with stress and nervous system, and there is not a single hormone that just gets impacted on its own. So the fact that it's named polyendocrine and metabolic syndrome just really helps everybody understand that there's a lot at play here. So I want to break down to help you understand with my little flow charts that I have drawn to understand it myself, to help my practitioners understand it, but also, of course, to help you, the listener, and my patients to understand what's going on in your body. And hopefully that helps you see why just a random supplement off the shelf like inositol or curcumin on its own are not really going to be enough. So let's jump right into it. And I'm going to draw some things out for you today. So we want to look at root causes first and see how far back it really goes. And there are three windows of origin. The first window is in utero, and there's a couple really great studies. One of the studies is if the mother has elevated androgens during pregnancy, so mom has high androgens, those androgens will cross the placenta and then directly program the developing fetal hypothalamus and the ovarian tissue, which essentially creates this epigenetic changes before the child is even born. So there's two really good studies, Rizal was in 2019 and Mumini was in 2021 that are both showing these things. So understanding mom's history is really important. And if mom had PCOS, then she likely had high androgens and insulin resistance and all of that, which of course gets programmed into the baby, which is why I'm so passionate about doing what we're doing, because we can literally build generational health. We just have to be really intentional about it. But it's not just about mom. The paternal metabolic issues is another really great study, and it was resolved again by 2023, so fairly recent. Essentially, they demonstrated that the reproductive and metabolic PMOS traits can be transmitted through the father to female offspring, not just through maternal androgens. So that's really cool to see and important to help our partners understand that the sperm quality really matters. Then maternal high-fat diet. And obviously we're talking about poor quality fats versus, healthy fats, but high-fat diet during pregnancy has been shown to change gene expression patterns and reduce follicle numbers in offspring ovaries, again, independently of the androgen levels. And that was found in 2023 as well. So we want to, as practitioners, in my practice, we're all trained to go back, and this is where our patients are like, what does this have to do with anything? We want to understand how far back the genetic programming is going and what we're up against in terms of what we're able to reverse and what we're not, what we need to, how much help the system will need to regulate itself. Then puberty is a really, really big component. And this is because the gonadotropin releasing hormones, so the GnRH pulses, get set. These are the pulses that get set to essentially the rest of the reproductive system, and the set is like for the rest of your life. So a child who arrives at puberty with already some epigenetic primed system, so let's see whatever happened, mom had higher androgens, or even mom and dad had metabolic issues, high diet during pregnancy for mom, and then there's a lot of stress during puberty, and these GnRH pulses get set, we essentially have a higher predisposition. Now, the GnRH pulse, it's the frequency. So if the frequency is too fast, that essentially creates issues, and I'm going to draw that out. What are some things that I would consider or what I look for during puberty? Divorce is usually big. Bullying is usually big. Some kind of move, any kind of trauma, or even things like lack of sleep. And again, whether that's sleep or there's moving and divorce or even sibling rivalry, something that's going on. But usually during puberty, I'm asking a lot of questions for my women with PMOS because I want to know how those pulses got set. The other really big one is oral or any contraceptive use, really. So if it's done 2 years before the cycle, so the cycle has started and it's been less than 2 years and you started birth control, chances are those gonadotropin releasing hormone pulsations are not set as strongly. So this is why it's really, really important, first of all, to try to avoid birth control at all if possible. But if for whatever reason the girl is going to go on it, to give her at least 2 years of those pulsations and the brain and the ovaries communicating on a regular basis to really set that tone and that foundation before she goes on to birth control. And then, believe it or not, just adulthood. It doesn't, sometimes we say, well, mom was good and there was nothing during puberty, but then we're looking at things like environmental toxin exposure. We're looking at just the levels of stress. For the puberty, the other one, when I put stress here, I'll say athletes. So my people who are really, really competitive and worked out a lot and potentially didn't fuel enough, that's going to be something that I'm looking at as well. But in adulthood, anything, essentially, it's this cumulative postnatal exposure. You can have the gut microbiome dysfunction and infections, the environmental toxic load. There's some insulin resistance. Let's say you're not eating well and you're not exercising and there's nutrient depletion. All of these things can contribute. And when I'm taking my history with a PMOS patient, I am looking at all of these components. Okay, so let me actually draw out. This is something that I was working on for a while, and I hope that you guys find it helpful. But what is actually going on in the body? Because if you understand this, then you know how you need to approach it, okay? So the gonadotropin releasing hormone pulsation is really important. So when that pulsation is dysregulated, meaning that the frequency is much higher than it should be, what ends up happening is it drives the LH pulsation. So it just drives the LH up, and then that LH and FSH ratio might be off, but essentially sometimes that's not the case, but the LH is still stimulating theca cells in the ovary. So let me draw out what actually happens. So let me share this diagram with you in terms of what actually happens in the body and how it's all interconnected and why we cannot rely on just one supplement or one intervention. And you'll see the complexity of this and why it's important to interrupt it. So essentially this GnRH pulse set is really, really important. And when we're under that high stress, the frequency increases. So when the GnRH pulse frequency is increased, it causes the LH frequency and pulsations to also be increased. So the LH hormone is much higher than it should be. And that basically stimulates theca cells within the ovaries to produce androgens. So now the body is hyper producing these androgens. When we have this androgen excess, there's the symptoms of having the acne, the hair loss, the weight gain, the inflammation. But what happens is you're not actually going to ovulate properly. And of course, that's a big issue because when you're not ovulating properly, your AMH is now going to be increased because instead of those follicles growing and maturing, basically they're staying arrested in a smaller size and then they continue to produce AMH. And the more AMH we now have this neuroglial disruption. And that is, neuroglial is essentially just cells within the nervous system. They're disrupted and they put a brake on the GnRH. Okay, they essentially, the brake is jammed, so then the frequency is increased. So when we have the neuroglial... All right, so let me actually draw out everything that's going on. And I hope you guys find this helpful, because the more that we can understand all of the systems that are at play, the more you will understand why just one medication or even one supplement is not really going to do enough. So let me just get right into it. So the gonadotropin releasing hormone pulsations is essentially what starts the whole feedback loop. So when that frequency is really high, so when we have that higher stress during puberty and the connection between the brain and the ovaries is set, and of course, like I said, there is some genetic predisposition to it from being in utero and having certain things that you're exposed to. But when that GnRH pulse, the frequency is higher than it should be, what happens is that the LH hormone gets released more than it should be. It increases the circulating LH levels, which the LH will stimulate theca cells within the ovaries to produce more androgens. Now, those androgens, we have the high androgens, and those symptoms are not great, whether that's acne or unwanted hair growth or hair falling out or inflammation, not being able to lose weight, all of that fun stuff. It also causes anovulation, so now you're not ovulating properly. And the androgens, there's a couple different loops, and you'll see why I'm drawing things the way that I'm drawing, but it decreases the skeletal muscle NAD. NAD is this really big, hot topic antioxidant right now, supportive for the mitochondria. So when we have a decrease in the skeletal muscle NAD, we have more mitochondrial dysfunction. My goodness. We have more mitochondrial dysfunction. And that's not good. That's not good for health. That's not good for fertility, because now if that skeletal muscle doesn't have the NAD and the mitochondria is not working as well, now we have insulin resistance. And the insulin resistance will decrease the sex hormone binding globulin, which actually will increase the androgens. So that's one of the feedback loops. Now, what's happening with this anovulation? When you're not ovulating properly, you are actually going to notice your AMH being much higher, right? Because the follicles are arrested in much smaller size. There isn't one that's being matured and ovulating properly. So you have a lot more little ones, but they're all secreting AMH. And so that AMH is starting to increase. And when that AMH increases, what ends up happening is we have something called neuroglial dysregulation. And this is something that essentially just helps to tone the GnRH pulses. And so when you have the neuroglial dysregulation, it feeds back over here and continues to increase the GnRH pulse frequency. So you see how it's a lot happening here and how it's all interconnected, but there is a couple of different pathways. And so as we get into, the testing and the treatment protocols, I want you to keep this in mind, because this guy is really important when it comes to treatment. So the GnRH pulse frequency, the androgens are going to become really important to help support our symptoms. And of course, that insulin resistance, that's so important to help regulate lots of different hormones. So let's keep going and let's talk about testing. It's really important to do a good assessment. So I think a practitioner that doesn't take your history in terms of childhood and puberty, and doesn't take maternal and paternal health history, they're missing out. They don't actually understand everything that's going on, and they're just trying to block certain actions without fully understanding how long this has been an issue for. So that's a red flag for me when someone, whether that's a holistic provider or a conventional provider, they're not asking these questions and they're going straight to, you need this for insulin resistance, you need this for androgens, this is the supplement you should take, you should exercise. And even though it's good advice, when there's no intention and no deeper understanding of what's going on, I don't find that the treatment works as well. So for your general testing, we do a lot of really good blood work. And again, you do day 2 and 3, day 19 to 23. And the big things that we want to know here is what's happening with the brain, how is it communicating to the ovaries, how is it communicating to the thyroid, what's going on with your prolactin levels, what's going on with your AMH levels. We also really want to assess your inflammation levels. We want to understand the insulin resistance component. Of course, we want to understand the testosterone and the androgens. We also want to understand the liver function, the electrolytes, the nutrients, what are you actually ovulating and how much, because there's women who will ovulate in PMOS. You can have regular cycles and not be ovulating. And this is why we want to use blood work to confirm. I will say that a CGM is something that's a continuous glucose monitor, is something that we always do for a minimum of 90 days with patients. And of course, you're going to get feedback right away. But this is, if you have PMOS and you don't know what's going on with your blood sugar, I think this is a huge blind spot. I also love to use Anito, and I do have a Dr. Jane coupon code if you want to get $60 off. But I love monthly tracking. Okay, so a lot of women will have low progesterone in that second half of the cycle. Even though Anito doesn't track androgens, you could see if the estrogen is dominant in the second half of the cycle. And then you can also keep a close eye on that LH and what's happening. So when we introduce, let's say, bioidentical progesterone, in 3 to 4 months, I would expect that the woman's body is starting to recalibrate. Now, we're never just doing progesterone on its own. We usually have to do a bunch of other things as well. But Anito helps to see that pulse. We can see what's happening every cycle instead of waiting every 3, 4, or even 5 months to retest. So I do like that information. When it comes from the functional lab side, the gut microbiome is really important. There's a component of disruption there. Methylation is always disrupted as well. And then I think a nutrient panel, when the body is really depleted, it's hard for it to do very much. So we generally need to bring the energy up, like your energy and the energy of the cells, so we can detox and we can reset. And then something like the Endo Insight Plus, which is essentially just equivalent to the dried urine test for comprehensive hormones, where we want to understand the adrenals and how they're working. We'll look at all of your androgens and how your body is breaking it down. So this is urine. It's not, we want to test the blood, but I also like to test the urine so we could see how the body is metabolizing things. It'll look at your estrogens and progesterones as well. And I find that that's super helpful. Some, depending on your history, you might need to do like environmental toxin panel. You might need to do a vaginal microbiome, a urinary microbiome, like a UTI screen that we do. Some of you might need to do a uterine microbiome. There's always a microbial imbalance in almost any disease, and it's not necessarily in the gut. Sometimes I see guts come out pretty healthy, meaning I'll look at the stool analysis and be like, this isn't that bad. Like, we can fix some things, but it's not that bad. But then we'll test the vaginal microbiome or the urinary tract and infection, the complicated screen. And that's where all the issues are. So every woman is different, and this is why proper history taking will allow us to narrow down those tests. And, you know, I'll have some people say, well, like, is it really necessary to do all of this testing? And the honest answer for you guys, like, it's not necessary to do anything. I think it just depends on how much pain you're in and what is your timeline. So there is times where I've tested this and been like, do you have PMOS? She's like, I have been thinking that, but no one can diagnose me. The problem is you are waiting to be diagnosed by a conventional system that's waiting to literally tell you that once you're diagnosed, here's a medication. And if you're in the fertility space, oh, you have PMOS, it's IVF. You have endometriosis, it's IVF. You have unexplained infertility, it's IVF. You have male factor infertility, it's IVF. Like, it's the same prescription for any issues. And the natural medicine route is we're looking at the body as its individual snowflake that you are, and looking at what the imbalances are and what your specific genetic makeup is and your environment and what do you actually need. So I don't often wait for a diagnosis. I don't care to get a diagnosis. If I see inflammation, if I see those androgens starting to creep up, if I see that progesterone that's not rising as high as it should, or even an LH surge. I have a 30-year-old where her LH surge is at like barely at 20. She should be at like 80 right now. So the fact that she's at 20 tells me that ovulation is not as strong as it should be. And as we track her through the Anito tracker, through all the stool analysis and methylation and CGM, we can tell that if I give her 10 more years or even 5 more years, she would develop PMOS. But why would I wait 5 more years when she's already uncomfortable and she's already struggling with infertility and she already has endometriosis? right? And just because you have PMOS doesn't mean you don't have endo. It is possible to have both conditions. It just means there is a big metabolic component and there's a big immune system component, which just adds even more complexity to the case. And we just have to dig in even more and really understand that history. So it is not necessary to do any of this testing if you don't want to. But if you are tired and you have been spending thousands of dollars on different random supplements over the years, this is where I am not going to recommend you any supplements today. I'm going to go through our treatment approach. But the reason I'm not going to give you any supplements is because I have no idea what you need. And if I tell you, oh, you should do inositol at this range, and you should do CoQ10 at this, and curcumin at this, and chromium at this, and you start taking those things, but you don't address your root cause, you'll feel slightly better for a little bit, probably, and then you'll notice nothing again. And I hate it when people say natural medicine doesn't work, because like, I've tried it and it didn't work. And natural medicine isn't just taking random supplements and seeing if it works. Medicine, part of it is still doing the investigation, the deep history, taking the testing, the data, the analysis, and being really present with a person sitting in front of you, really understanding what their body is carrying and how long it's been carrying for, and then prescribing things based on their individual needs. So I love testing. It gives us data, and people feel better very quickly. And when they don't, it's typically because we're not doing enough and we didn't implement enough in terms of the lifestyle changes. And I definitely have had those conversations with my patients as well, where I'm like, listen, we're seeing great progress, but it's just not fast enough, knowing your age and knowing how much more you have to go. Whether that's a patient that has another 100 pounds to lose and she's already lost 30, and it's like, that's fantastic. But we have a lot more to go, and we're going to run out of time if we don't change things up, and that's just part of adapting and making the necessary changes. So let's talk about some of the treatment things that you need to think about when you want to approach PMOS. So first of all, the nervous system regulation is really, really important. And I think most people just kind of focus on the ovarian aspect, the androgen aspect, and the insulin resistance, and they forget that the disease starts in the brain. So there is an epigenetic predisposition, I would say, for most people now, whether that's the mom had high androgens and she didn't know, whether there was some metabolic disease for the dad or even the mom, and then, of course, that higher maternal fat diet. So those are just like 3 studies that I showed. There's other things going on, obviously, but those are just things that we know are there. So if you're just focusing on the androgens and the insulin resistance, that's at the bottom of this chart. And that's why I find that most people are not getting the results that they want, because they forget about this nervous system regulation, which is actually where the disease starts. Okay. Now, blood sugar is really important to address. And I'll talk about some specific recommendation in a minute. Gut microbiome is really important to address. And there's more studies around their estroblome and how estrogen detox impairment and how it's connected, to everything, but to that progesterone, the higher androgens. Hormone balancing is really important. So this is the androgens. It is the, making sure that the estrogen is where it needs to be. So usually decreasing estrogen, but increasing progesterone. I do think methylation is impacted for everything. Methylation is a biochemical process that happens in every single cell of the body. If you have disease, you have glitches in your methylation. So looking at methylation, and we do genetics and nutrients. If you just do genetics, it's helpful, but the nutrients really help us understand what your body is working with. And then I think the psychospiritual, where that's trauma processing, mental, emotional, all of that stuff, and it is connected to the nervous system regulation. Your nervous system cannot rest when it's stuck in fight or flight. A couple of interesting themes that I see, and I have been working with my mentor, Dr. Leah Hedgman, for a while now. So some of the things that she has shared with me, which now I also see in practice, is this lack of ovulation is actually a fear of transformation. Because if you think about what happens during ovulation, is a big transformation of the cell. And I think that it's also connected to this fear of full expression and full potential, which then is connected to some kind of lack of acceptance for being yourself. And then it's connected to worthiness and all of that stuff. So this is quite a bit to unpack, but it is something that I think is really important to address. And, I do quite a bit of counseling with my patients, but I also have some people that I recommend, and whether that's like EMDR or tapping therapy or something. But I do find that this is an important component. All right, last thing. I know your brains are probably full, but you guys can listen to this episode as many times as you need to. I'm not going to go through supplements for the reasons I've listed above or before, but I do want to tell you about some lifestyle things. And if you do these lifestyle things really well, you will move the needle quite a bit. I do think, depending on the progression of the disease, if it's progressed quite a bit, you're just going to need to do more of it. So one of my patients who has 100 pounds to lose, she needs to do everything, and it's a lot. And so we've coached and we adapt as much as we can, but it's the more load you're carrying, the more you need to do. And really it's just finding that right sweet spot for each patient and walking them through that, because it's a big change. So movement is really important. Obviously nutrition, sleep, the circadian rhythm component, the nervous system regulation, and then of course your environment. So for movement, because that NAD is depleted in the skeletal muscle, and that causes the mitochondrial dysfunction, that's one of the fundamental issues with PMOS. You need to put on muscle. You need to preserve it as much as you possibly can, which means you need to lift weights, not doing a bunch of HIIT training to stress your system out even more. And you need to walk lots. Most of my patients, I'll recommend 10 to 12,000 steps a day, some as high as 15,000. And it's really important that 10 to 20 minute walk after each meal. So if you do that, plus you do some random other walking around, you'll be able to hit that. But lots and lots of movement is important. So if you're working and sitting at a desk all day, you need to be getting a walking pad and set your environment up for success to be able to do that. My husband and I, we just moved, and the first thing we do is find our walking loop. Which way are we going to walk, and how is it? Is there a perfect circle, or is it in and out? It has to be something that we enjoy. And I'm always amazed of how little people walk outside, even when the nature is really nice. We've just been trained not to walk, and I'd love for you to walk outside and tag me on social media and be like, I'm getting my walk in today, Dr. Jane. I want to see more people walking outside. It's whether it's, below zero, or it's above 100, like there's times in the day that you can absolutely still make it outside for a walk. So it's important. And like I said, putting on muscle is literally what's going to reverse your PCOS. Nutrition. So this is where the CGM comes in. And for 3 months, I don't want to see a blood sugar over 120. And we obviously don't want to also dip below 70 a bunch, because that tells me we're under fueling. Usually within the first couple of weeks or the first 30 days, you get a gist of what your system can handle in the first half of the cycle versus the second half of the cycle. And you will get pretty quick feedback loop. It has to be protein focused. Usually women with PMOS cannot handle carbs very well at all. Processed or not processed, like sweet potatoes or fruit, for some women is a complete no-no, where for others they may be able to handle it before they exercise or right after they exercise. So this is why I like the CGM, because you can play with it and you don't have to restrict yourself unnecessarily. And you'll see the more you move, the more flexibility you'll have with your nutrition. I think fiber is super, super important. So you notice that I said the carbs are low, the fiber has to be quite high. And so I lean on fiber powders, so things like psyllium husk, flaxseed, inulin powder. There's a bunch of different fibers out there now. But also you're thinking about vegetables, the cauliflower, the broccoli, all the brassicas, the kales, the Swiss chards, the cucumbers. You essentially are just trying to have lots and lots of fiber to make sure that the digestion is working well. The sleep and the circadian rhythm, I'm going to draw it over here. That's really important. It's 8 hours of sleep. I would say 1 hour or more before bedtime. Absolutely no screens, but I would say no heads over light. And if you can, only amber or candle light. This is really big. And then preferably 3 hours before no work, and you're just essentially resetting your circadian rhythm to make sure that you're sleeping enough, getting sunlight on waking. So within the first 30 minutes of waking, you're just going outside and looking at the sun, enjoying your coffee or going for your walk in the morning. Also, I would prefer that you do something in the evening as well. So the circadian rhythm with the sun is going to reset. Nervous system regulation, vagus nerve stimulation, humming, singing. They do have, things like falsetto where you can put them on and actually help to stimulate your vagus nerve. There is outdoor time. That's actually so much research around forest bathing or nature bathing of any kind, whether that's you're by the ocean, you're in a lake, or you just have to get outside, get your phones off your body, all your tracking devices, and just go into nature to really unplug. And ideally, you're doing that 30 minutes a day. And on the weekends, it's like 2+ hours. If possible, I think that is probably the most underestimated one, but really important. And it's important that you turn the phone off versus you take the phone with you and you're then in nature. It's better than no nature at all, but I need you to just be off the phone and off the EMFs. Trauma processing is really important, and whether that's counseling, EMDR, tapping therapy, even psychedelic therapy, whatever it is to just help reset your nervous system and that gonadotropin releasing hormone pulsation. That's where it all, quote unquote, starts. And environment, obviously, you want to decrease the toxic load, exposure. There's usually probably some kind of detox. There's usually some kind of dysbiosis in the gut that you need to deal with. And this is where I would say the testing really comes in. So then we can do supplements that are, specifically curated on your tests. So the tests give us data. And what I will say is if you've done all of this and you do not feel any better, what I want you to know is it's not that your body is broken and this is it. You're just meant to live with a PMOS condition for the rest of your life, or IVF is your only option. It just usually means that you're missing something. And the body is really smart. It is your home for this time being on this planet. And I really encourage every woman to learn how to live in it, because being pregnant is you ultimately being able to trust your body unconditionally to do what it's designed to do. It is just hard to do it when you have no idea how the system actually works and you don't have a good relationship with your body in the first place. Whether it's you're always blaming it for, you're mad at it because it's not doing what it's supposed to, or you're just completely disconnected from it. And being completely disconnected from it and blaming it and being frustrated with it is just, it's the same issues, just different sides of the spectrum. So I really want to encourage you to never give up on your system. And I hope that all of the things that I've drawn out helps you understand the complexity of what's going on and why I don't just recommend one single supplement. Because let's be honest, it's not even that it's one single supplement, but there's phases. Like we might need to clear parasites first, and then there might be a bacterial infection, and then there might be a toxin that we need to address, like a heavy metal. Or we might need to focus on this, big estrogen dominance and progesterone while balancing blood sugar. And there's a big mental emotional trauma component that you're also dealing with. It's all interconnected, and you can't do everything all at the same time. And I can't tell you, even with my practitioners, when we all have our clinical meeting once a week and we talk through cases, it's here's the general information. How are we going to personalize it to each individual? Okay, that's always how we're looking at cases. So if you guys found this really helpful and sounds like something that you're looking for, please fill out an application down below. My team will get back to you and we can see if we're the right team of practitioners to help you. If we can, we'll show you what that looks like. And if we can't, we'll still point you in the right direction. But I really hope you enjoyed this podcast. Please share it with somebody if you think they would find it helpful. I'd love to get this information to more people. Otherwise, I appreciate you being here. Thanks for tuning in, and I'll see you next time.